Dear students, let us discuss about the extensor expansion. So what do you understand by extensor expansion? Extensor in relation with the extensor aspect of hand or foot. And then the expansion of what? The expansion of the extensor tendons. So we are going to discuss about the extensor expansion in relation with the hand and in relation with the foot. Let us look at a case scenario. See the picture. A football player who is practicing it comes with a bent middle finger of his left hand, and he could not make it straight, and it is swollen. There is swelling of the proximal interphalangeal joint and the second knuckle. He gave a history of hit to his middle finger by the football. On examination, the joint is swollen and tender. The finger will not be pulled straight easily. So with this background, think over what do you call this condition and give anatomical explanation for the condition. So extensor expansion is also known as extensor hood, dorsal expansion, dorsal hood, or dorsal aponeurosis. All means the same. These are all the synonyms for the extensor expansion. So what is this one? Structurally, it's a specialized connective tissue band, or we call it as aponeurosis, by which the extensor tendons of the disease, they get inserted into the phalanges. So these will be passing over the proximal and middle phalanges. So you can see the extensor digitorum communis tendon and how it is splitting into a central slip and lateral slips and passing over the proximal and middle phalanges, and the terminal part getting inserted into the terminal phalanx. So hope you have understood the synonyms and the structural components of the aponeurosis of extensor expansion. What is that you will find in the extensor expansion in general? So it is triangular. You can see the shape of it, and it's a fibrous or aponeurotic expansion seen on the dorsal surface of proximal phalanx. That's why extensor hood or dorsal hood, and it is formed by insertion of the tendons of long digital extensors, the lumbricals and the interosseous muscles. These are the structures that constitute the extensor expansion. At the distal end of the metacarpal bone in the case of hand and metatarsal bone in the case of foot, the extensor tendons, they will expand and form the hood that covers the back and sides. It's covering both the back and sides of head of metacarpal or metatarsal and proximal phalanx. So the distal end of metacarpal and the proximal end of the phalanx, they will be covered by the extensor hood in the case of upper limb, and in the case of lower limb, it is the distal part of the metatarsal and the proximal part of the proximal phalanx will be covered by these tendons. So if you see here, the flattened tendons of these long extensor muscles, they will be spanning the proximal and middle phalanges, and they are separated into three slips. One is the central slip, it gets inserted into the base of middle phalanx, and there are two lateral slips. So this is the central slip and these are the two lateral slips. So they are getting separated and diverted on each side, and they are going along the central slip to get inserted into the base of distal phalanx. So the base of it will form a hood over the head of metacarpal or metatarsal bones, and through these extensor tendons they get attached to the phalanges, and then what is joined to them is the interossei and the lumbricus, which we will see in the next slide. So here you are seeing the central tendon of extensor digitorum and the two lateral slips of it. So the central tendon getting inserted into the middle phalanx and the lateral slips to the terminal phalanx. These are all on the dorsal aspect of the digit. You see the triangular extensor expansion you are seeing, and it is reinforced by the lumbricus and interossei muscles. So these are called wing tendons. So proximally you will be seeing the reinforcement from the interossei, and distally will be the reinforcement from the lumbricus. So medially what you will see is the interosseous muscle, and then laterally you will see both interosseous and lumbricus. Medially only interosseous muscle. And so now you have understood about this reinforcements for the extensor tendon. So each of this expansion, it will be forming a movable hood. It moves. So it moves distally when the metacarpophalangeal joint is flexed, and it moves proximally when the metacarpophalangeal joint is extended. So try with the flexion of the metacarpophalangeal joint and extension of the metacarpophalangeal joint in your hand or a finger, and see that it moves distally when it is flexed and proximally when the metacarpophalangeal joint is extended. If you see the extensor surface of thumb, there is no proper extensor expansion. What are the tendons you will see? Extensors pollicis brevis and longus. They are inserted into the proximal and distal phalanges. So extensor pollicis brevis into the proximal phalanx and longus into the terminal phalanx. So the tendon of extensor pollicis longus muscle, it is receiving a fibrous expansion from abductor pollicis brevis and adductor pollicis muscles. So the abductor pollicis brevis and adductor pollicis muscles are serving the purpose of digital extensor expansion in relation with the thumb to hold the extensor tendons in place on the dorsal phalangeal surface. So you have understood about the extensor expansion in relation with the thumb formed by the extensor pollicis longus and brevis, then supported by the expansion from the abductor pollicis brevis and adductor pollicis muscles. Now let us look at the tendons for the extensor expansion of the fingers 2nd to 5th. If you take the extensor digitorum slips, they are there for all the 4 digits. If you take the lumbricals, there is lumbrical for each of the 2nd to 5th digits. And if you take the dorsal interossei and palmar interossei, see the figures. If you see the dorsal interossei, there are 2 dorsal interossei for the middle finger, whereas 1 each for the 2nd one and then the 4th one for the dorsal interossei part. Then if you take the palmar interossei, there is 1 for the 2nd and 4th and 5th digits. There is no palmar interossei for the middle finger. Why? Because the axis of the movement is the middle finger in the case of the hand, and along the axis the movements of abduction and adduction takes place. And here you recollect the palmar interossei or adductors towards the middle digit. They will move the adjacent fingers, whereas the dorsal interossei or abductors, they move the digits away from the middle finger. Hope it is clear to you about the extensor expansion tendons for each of the digits. Now let us look at the clinical case scenario with which we have started our discussion. So see the condition of the middle finger in a football player who was practicing and had an injury. And what do you call that condition? This is known as the quaternary deformity. What is the anatomical basis for this condition? This condition results from injury to the tendons that will be straightening the middle joint of finger. This is the middle joint of finger. So what are they? They are the long extensor tendons. This middle joint will be injured and cannot be made straight. So there is flexion at the proximal interphalangeal joint and hyperextension of the distal interphalangeal joint. There is a disruption of the central slip of extensor tendon that gets inserted into the base of middle phalanx on its dorsal aspect, that is disturbed, and then there is the central slip and lateral slips. They migrate towards the palmar aspect. So there will be extension at the metacarpophalangeal joint and distal phalangeal joint, interphalangeal joint. There is extension. Then there is flexion at the proximal interphalangeal joint. This is the explanation for the clinical case, which is known as the quaternary deformity. Now see this picture. See the metacarpal bone and the phalanges and flexion at the metacarpophalangeal joint, and then what is extension of the interphalangeal joints. Okay. Now let us see whether you can answer it. Can we extend the proximal interphalangeal and distal interphalangeal joints without extending metacarpophalangeal phalangeal joint. Yes, try it. You can do it. Okay, you can extend both proximal and distal interphalangeal joints without extending the metacarpophalangeal joint. So, what is the reason? The passive flexion of metacarpophalangeal joint elongates the extensor mechanism and extends the proximal and distal interphalangeal joints. Then look at the other question. Can we extend proximal interphalangeal joint without extending distal interphalangeal joint at the same time? You cannot do. Then the other scenario. Can we flex the distal interphalangeal joint? Can we flex the distal interphalangeal joint, that is here, without flexing the proximal interphalangeal joint? No, you cannot perform. So, you cannot extend proximal interphalangeal joint without distal interphalangeal joint extension. And similarly, you cannot flex only distal interphalangeal joint without flexing the proximal interphalangeal joint. Let us get explanation for these two questions. Then see another question. Why full flexion of proximal interphalangeal joint prevents active extension of distal interphalangeal joint? Why? Extension of this distal interphalangeal joint is produced by extensor expansion. Tension in the central band of extensor expansion can extend the proximal interphalangeal joint, and tension in the lateral bands extend the distal interphalangeal joint. So, the tension in the extensions of extensor hood, the central band extends the proximal joint, and tension in the lateral bands extend the distal interphalangeal joints. Now let us discuss about the extensor expansion of the foot. So in this picture you are seeing the extensor tendons. These are the extensor tendons and how the expansion is formed in relation with the toes. It's by the extensor digitorum longus for the lateral foretoes, which will expand in relation to the dorsal aspect of proximal phalanx, and it is supplemented by the tendons of the lumbricals, the interossei and the extensor digitorum brevis. So, the extensor expansion of the toes is formed by the extensor digitorum longus, which divides into two lateral strips and one central strip, like that in the fingers. And the central one is inserted into the base of the middle phalanx. The two collateral strips, they will be inserted into the terminal phalanx. And this extensor expansion is joined by tendons of one lumbrical muscle and two interossei muscles and the tendon of extensor digitorum brevis. So, all these are contributing for the extensor expansion of the toes. There are certain exceptions are there. That is, for the little toe, there is no tendon of extensor digitorum brevis. There is only one lumbrical and one interosseous muscle. For the big toe, there is no extensor expansion, and it will be having the extensor hallucis longus, which is inserted into the base of terminal phalanx, and extensor hallucis brevis, which is inserted into the base of proximal phalanx. So the actions of the extensor expansion is through lumbricals and interossei. So they produce flexion at the metatarsophalangeal and extension at the interphalangeal joints. So same as that of the upper limb in the hand. Let us look at the table similar to that of the upper limb. So the tendons for this 4 digits, second to 5th digits. They are the extensor digitorum longus for all the 4 and extensor digitorum brevis is not seen for the little toe. Whereas the lumbricals are seen for all the 4 toes and the dorsal interossei are seen 2 in relation with the 2nd digit and 1 each for the 3rd and 4th digit. Whereas the plantar interossei are seen only for the 3rd, 4th and 5th digit. So why there are 2 dorsal interossei for the 2nd digit, whereas in the case of upper limb you have seen the 2 dorsal interossei in relation with the middle finger, because the 2nd digit is the line of axis for the foot. For the upper limb or for the hand, it is the middle finger is the axis. That is the explanation for it. Hope you have understood about the extensor expansion in relation with the hand and in relation with the foot.